Okay, good evening, everyone. Good evening. We are about to start our webinar. Let me say thank you to those of you who are on the line. I'm excited to present this webinar tonight. This is our third webinar from the healthcare staffing series. And I know that you are going to be learning some things tonight, especially if you are a new or an aspiring business owner looking to start your healthcare staffing agency. So I don't know where you're calling in from or you're tuning in from, but if you are in an area that it is cold, I'm so sorry. I'm so warm here, right here in South Florida. So thank you for joining, and we're going to get through this as fast as we can. If you are on the line and you have a staffing agency already, just drop a note and say, I have a staffing agency, or I don't have a staffing agency. Just say that I have a staffing business, healthcare staffing business, or I don't have a healthcare staffing business. Just want to see who is on the line. And as we go through this presentation tonight, I'm going to ask you, if you have any questions, just drop your questions in the chat box, and we will try and answer all your questions as we go through the presentation tonight, okay? All right. Once again, guys, my name is Eva Francis. I am a former hospital nurse executive, a nurse entrepreneur. I'm a healthcare and leadership consultant, and also a business strategist, particularly for healthcare professionals. If you can hear me clearly, drop me a note in the chat box. I want to make sure that you can hear me before I get further in the presentation. So just drop a note and say, yes, I can hear. In that way, I know that I don't have a staffing business. I don't have a staffing business. Good evening. Thank you so much. You are clear. I appreciate that. Awesome. Okay. So let me get back to my other slide here. All right. So I am the Senior Vice President for two companies. One is the Brilliant Healthcare Coaching and Consulting, where we help professionals to pursue their passion in the areas of leadership and entrepreneurship. And our next business is Brilliant Healthcare Recruitment and Staffing Corporation, where we connect and place brilliant nursing talents to healthcare organizations. This is a healthcare staffing agency. All right, so just a little bit about my story, as I'm the presenter here tonight. When I left corporate healthcare a few years ago to launch my own consulting, coaching, and staffing business, I didn't know how that was going to work out, but I know that I was in an organization, and that my passion of entrepreneurship was calling. And I really, really wanted to pursue that dream, because I've been wanting to become or to be an entrepreneur for several years. And even though I was a successful nurse executive overseeing a lot of areas and enjoying the place, and everyone there thought I was there to retire and I was going to be there till the end of my journey, I knew that I wanted to build my own legacy. I knew that I did not want to stay there and keep building, because I was a vital person in the organization. And I know that everything, I was there. Disaster, I was there. Joint Commission, I was there. Everything going on. I was there from Sunday to Sunday, even after church sometimes on Sundays. I'm in that emergency department, helping to move patients and to triage patients. So after a while, I felt like it was time for me to make a change, to make a shift. When we started, as far as the shift is concerned, I started into the healthcare coaching, consulting, and training space. I had the recruitment and staffing firm for a long time, but we weren't super active with that. But when COVID started in March, or I should say just before COVID started in March, we resurrected our healthcare recruitment and staffing business. Before that, we were doing a lot of international recruitment, and we are really responsible for a lot of international nurses that's in this country, because our organization, have done a lot of recruitment. So now we are focusing on healthcare staffing locally and nationally. So tonight we're going to be focusing on healthcare staffing, and I'm looking at the disciplines that I'm looking at are registered nurses, LPNs, CNAs and allied health. When I say allied health, I'm talking about respiratory therapists, I'm talking about occupational therapists, pharmacy techs, but particularly nurse practitioners, registered nurses, CNAs, and LPNs. All right? Okay, so I want to share with you that the global healthcare staffing market size is estimated to be 33.8 billion in 2020. That's a lot. 33.8 billion. And why shouldn't you try to get a portion of that, right? So a significant rise in the geriatrics population has been one of the major contributors to this market growth over the past few years. And now comes COVID-19. Hospitals are hurting for staff, guys. Organizations are depending on contract nurses, PRN nurses, supplemental staff to take care of their patients. Because there are so many nurses out there today who are leaving the profession because they're not able to handle what's going on with COVID-19. There are many leaders, nurse managers, nurse leaders who are actually planning on transitioning themselves into consulting. I have been in, I've been in contact with many of my nurse leaders, colleagues, and I've been, constantly in communication with them. And it's not easy being at the bedside. So while we are encouraging our nurses to stay at the bedside to take care of patients, we want to make provision for those who want to become entrepreneurs. We want to make provisions for those who want to become a nurse consultant, a healthcare consultant. We want to make provision for those who want to launch their own healthcare consulting firm or their own healthcare staffing firm. So tonight we are going to focus on that, the staffing industry, because that's one of the key need right now in the healthcare industry, whether we're talking locally or nationally. Okay? So how to launch a healthcare staffing business? There are a few factors you have to take in consideration when you decide that you want to launch a healthcare staffing business. You want to make sure that you want to start thinking that you are becoming an employer, no longer an employee. You're going into business. You're building your dream in the area of becoming not an employee anymore, but have the mindset of an employer. So you're going to start changing your mindset and start thinking, now I'm going to be leading people. I'm going to be supervising my nurses. And so you have three sets of people who you are going to be in charge of. Three sets of people you are going to be connecting with. Three sets that you are going to be leading. Number one, you're going to be managing and leading the people who work in your office, whether your office is home office or your office is away from your home. That's number one. Number two, you're going to be leading and managing your clients, which is the hospitals or the long-term care facilities or the rehabs, wherever your clients are generating from. And the next set of individuals that you are going to be leading are your nurses or your CNAs or your pharmacists or your respiratory therapists. It depends on your niche, whichever direction you want to go. So you have to start thinking that I'm a leader and I'm going to be leading individuals. So that's when you're going to start developing not just your business skills, but your leadership acumen as well. So the staffing model that we want to talk about tonight, we don't want to get it too complicated because we want to be streamlined. Because when it comes to niche, the way the people talk about it, it doesn't matter whatever you're doing, it's always good to narrow it down and stay focused. According to Business Mogul, they said that there are riches in your niches. So tonight we are going to be talking about contract staffing. We're going to be talking about supplemental staffing. We are going to be talking about per diem staffing. And this is what we want to talk about tonight. But when it comes to contract, supplemental, and per diem staffing, of course you can branch out from that. You can branch out and go into traveling nurse. You can branch out and go into recruitment, where you recruit nurses and just present them to organizations. But we want to stay focused tonight. So we want to look at nurse practitioners, RNs, LPNs, CNAs, and allied health. All right? Okay. So the first thing you want to do is you want to make a decision. You have to make that decision that I am ready. And the reason why I said making a decision is the first step, because you have to start thinking now that this has to work, because I am going to build my empire. I'm going to build my own legacy. I'm going to build my business. Many people go into business today, and one of the main reasons why it doesn't work, they go into business think, oh, you know what? If it doesn't work, I don't believe in a plan B when it comes to business, because if you have a plan B when it comes to launching a business or launch your own empire, guess what? You're going to go easily into that plan B. As soon as the business doesn't work, you're going to run back to that plan B. So let me just share this with you. Whether it's a healthcare staffing agency, a CNA school, or a CEU provider business, or any kind of business you are going to start, please start focusing on it must work. Because when you have that limitless mindset, it will work. But when you become limited and start thinking, oh, you know what? If it doesn't work, I'm going to go back to work. Before you know it, in 3 months, you're going to go back to work, because it's not going to work right away. Your business will work, whether it's a healthcare staffing agency or any other business, when you make up your mind that it is going to be working, and it's going to work no matter what. When I left my hospital senior position, I was making good money. I had a great job, but I knew it was time for me to transition into something different. But I never thought that if it doesn't work, I'm going to go back. I never thought that if it doesn't work. A lot of people was shocked when I left the hospital. They were so surprised that a lot of people thought that maybe Eva Francis got fired as a senior leader in the nursing realm. I was overseeing many departments, including like 5 critical care units and the emergency department. People thought, oh my God, when if Eva got fired? Wait, why did she leave? But the simple truth is, I wanted to pursue my passion for many, many years, and I had an opportunity to do so, and I just made that bold move, and I never looked back. Well, was it difficult? Yes, it was. Was it hard to leave? Yes, it was. Was it hard to start growing a successful business? Absolutely. We have to hire people. We had to hire independent contractors, different administrative staff, and it was not easy. Some days I felt like I was back in the hospital leading people. But guess what? I made up my mind that I'm not going to look back, because this is the route. I want to manage my own time. I want to fulfill my own dreams. I want to have more time with my family. And this is the direction that I'm going to go. And I'm so glad I made that decision 6.5 to 7 years ago. Okay, so you're going to have an employer mindset, as I said. And I had a compelling why. And I want you to know tonight that if you're going to start your business as a healthcare staffing agency, start thinking that you must have a why. Why are you doing what you're doing? You know, the great Zig Ziglar once said that when your why is greater than yourself, you do not need to figure out your how. Because when you have a why, you are going to figure out the how. It's gonna work, because you know, my why is spiritual. My why is for family. My why is for my children. My why is for my community. Whatever your why is, make sure that it's at the forefront of your decision. And you have to remember that if you don't like something, if you don't like the way things are going in your organization, in your department, make a change. And the change doesn't have to be entrepreneurship. Maybe you just need a geographical change. Maybe you just need a departmental change. Make a change. The decision is yours. You have the power to make changes in your organization, in your life. You have the power to step outside of your comfort zone and maximize what you have on the inside of you. Because a lot of time we have so much power on the inside of us, so much creativity, so many things that we can do, but we are afraid to step out there because we are afraid of failure. Yes, failure is there, but when you fail, you will fail forward. Get up and keep moving. If this is a decision that you're making, do it and maximize yourself and go all the way and say, you know what, no matter what, I'm not going to drop this. No matter what, I'm going to continue this game, and I'm not going to stop until I succeed. And then you have to decide for yourself, what is success for you? What does success look like? Is your success looking like a bunch of money? That's up to you if you want your success is that. If your success is helping people, impact lives, you have to define what success is for you when it comes to staffing your own agency. As we talk about the employer mindset, a business mindset is a way of thinking that enables you to uncover and see problems as opportunities. I saw a problem when it comes to staffing during COVID-19. That's one of the reasons why we expanded our staffing agency and our recruitment agency, because I had organizations were calling us and asking us, do we have the nurses to help them? And that's why we expanded, and it took off so great. And I initially said, oh my God, I cannot compete with all these giant agencies like American Mobile and MedPro and those big agencies. But guess what? When you create something that is so unique and so specific, organizations will seek you out. So there are ways to build your staffing agency where it doesn't matter how small you are, they will seek you out because you are unique, you are specific, right? So, and then turning these opportunities into a business. So whatever opportunity, when you see an opportunity, if you look on Indeed and see a hospital is hurting for staff, or a nursing home is hurting for staff, when you read the news and see what's going on with COVID-19 out there, and I'll see how nurses are tripling up in ICU, quadrupling up in ICU, busy. We have COVID patients in COVID, we have COVID patient nurses taking so many patients. You know that the hospital is hurting. So it's your responsibility as a staff, a healthcare staffing owner, to tap into that opportunity. Contact that hospital, contact that nursing home, contact that rehab, the school, that correctional department, and say, listen, I have a company and I can help you. You know, I got this definition of entrepreneurship from one of our colleagues. Her name is Santasia Walker. She said, entrepreneurship is not about escaping traditional nursing. So if you're there tonight and you're thinking, I'm going to start a business, but am I escaping traditional nursing? No, you're not. You're availing yourself to opportunities to be creative. Entrepreneurship is not escaping traditional nursing. You're availing yourself to opportunities to be creative and still operate within the nursing profession. It's an opportunity to be creative. It's an opportunity to be innovative. And at the same time, you are pursuing your dreams. So if you decide that you're going to step into entrepreneurship, you're creating that change. You're actually transforming healthcare. So you're impacting lives. You're pursuing your passion. You're building your own legacy. And of course, if you have a passion for business, you are pursuing that, because you'll never feel fulfilled in your life until you pursue the dream that's on the inside of you. Anything God placed on the inside of you, it does not matter how long it takes, guys. If you are anxious and feel frustrated and worried, tap into what's going on the inside of you and ask yourself, am I fulfilling my dreams? Maybe your time at the hospital bedside is over. It's over. Maybe you max out on the time in the organization. And I'm not chasing anyone away from the hospital or from the bedside. I'm not at all. But when you see that it just doesn't fit right anymore, maybe it's time for a new chapter. Maybe it's time for a shift. Maybe it's time for a new day. And that's how I knew it was time for me. But did I move initially? It took me actually a year and a half to make that decision, almost 2 years. I was walking around thinking with my resignation in my pocket, oh, am I going to do this? What are they going to think? What are they going to say? Are they going to escort me out? Because I'm a senior leader. Are they going to escort me out? That people think I did something wrong. I didn't know, and I prayed about it. I fasted about it. I did everything before I got the peace to step outside to launch my own company. And I love it, because going out there and launching my own company, I'm impacting more lives. I'm helping so many healthcare professionals, so many nurses. I wanted to write my own books. I wanted to build have my own conferences. I wanted to do all of this. I wanted to maximize myself, my thinking, my creativity, and be more innovative. And that's my only way that I could do it. So I'm glad I did. The second step is the legal aspect of the business. Your legal aspect, you want to create a business plan. And a lot of people create business plan, and the business plan is very complicated and complex. Guys, I want to tell you this. Any business plan that you are creating, it needs to be simple. A simple one-page business plan is fine. I know people out there make millions of dollars without a business plan. But business plan is overrated. And people have like 15 pages of business plan, and all it is a big booklet in their office. They never use it. Make your business plan as simple as possible. How much money you want to do this, what you want to do in the next 3 years, what you want to do in the next 5 years. Your business plan is supposed to be readable, it's supposed to be reader friendly, and it's supposed to be, as you look at it on a regular basis, you understand where you are on your business plan. Don't make life complicated. I've seen too much craziness out there. People call cute word business plan, but guess what? It's not of any use. You're going to establish a business entity, of course, LLC or an incorporation or a sole proprietorship, whichever one you want. You're going to establish that in your business. And of course, you need an EIN number, register your business, and that's basic. Everyone will know that, but I want to reinforce that. If you're going to start a staffing agency, you want to also check out your state to see if check your state to make sure that there is no business specific license that you need. There are some states that you need a specific state license to start your staffing agency. There's like Florida. I'm in Florida, and you have to, in addition to registering your business in Florida, if you want to start a staffing agency, you must apply to ACA for that business specific license. Staffing agency license. Some state like Georgia, you don't need any for Georgia. Arizona, you need one. Illinois, you need. Kentucky, you need. North Carolina, New Jersey, Nevada. Places like Texas, you don't need one in Texas. A lot of states. So if you are going to start your own staffing agency, check out your state to make sure your Department of Labor or your state healthcare services area to see if you need to have a specific licensure for the healthcare staffing agency. If you don't need any, well, all it takes is your business license, and you register that business with your Secretary of State, then you move on. States vary. The rules vary. Even with policy and procedures, you have to be specific with your state. So whichever state that you are going to do your staffing agency, start thinking, what is it in my state? Is my state one of those that I need a specific license? There are many states that you can work your staffing agency from home. Most states you can, but there are a few out there. Very few states out there that you have to have a physical location to start a staffing agency. So you want to really check that out thoroughly. Listen, do I need a physical location? Do I need an office? So you just get an office. And as I said before, very, very few states out there is asking for that. So make sure you check that out if you are going to start your staffing agency. Listen, guys, a healthcare staffing agency is I always call it the hidden treasure of a business that a lot of people don't know about. You have to work it, and it works when you work it because there's a need. You're solving a problem, guys. You are solving problems, staffing issues, recruitment issues. All right, so a couple of the things that you need a professional liability insurance. You need general insurance, general liability, income tax, workers' comp. You need those kind of to check those out, especially a professional liability. Some hospitals or some long-term care facility, they won't even sign your contract before they want you to show them that prove that you have a professional liability insurance. So that's important. So in that way, you want to consult a tax professional or a lawyer or any kind of legal professional to help you to figure that out as far as that is concerned. So you want to read up on that or consult your professional, your legal professional to assist you when it comes to your licensure, because that's very, very important, and your tax. The next step is the hiring and recruitment process. You want to hire qualified professionals. You want to hire people from, you can tap into your resources, like nurses that you or CNAs that you have worked with in the past. Tap into relationships are good when it comes to this business. So if you are no longer working in a hospital, contact those people you have worked with and people out there. You can go on Indeed to hire nurses, and you can talk about this in your community. You can go on LinkedIn. You can have a Facebook account, LinkedIn account, Twitter and Instagram. All of these social media platforms are really good. Word of mouth is powerful. Join your professional organization or your community organization, like your chamber of commerce. You can talk about your business there, and the word gets around. But nothing like word of mouth. Word of mouth is powerful. I get so much support, nurses and business, I should say, just by word of mouth. Word of mouth works. You have to have great relationship with people, connect with them. If you have to leave your job, make sure you don't burn your bridges. Make sure you connect, get to know who is your HR person, get to know their email address, your staffing person, because you may want to call them back and ask them for a contract or ask them for an agreement. So you want to have good relationships. No matter what, have excellent relationship. Excellent relationship works. Please drop your question in the chat box as I go along, because I'm going to be stopping to answer questions in a few minutes. Step number 4. Marketing services. When it comes to marketing, doesn't matter what business you're doing, whether it's staffing or any other business, you have to market every day. One of the main reasons why a lot of individuals don't succeed in their business because they market once a week. People have stuff like marketing Monday. If you are a new business owner, you cannot have a marketing Monday or marketing Tuesday. Marketing is 24/7. You go to church, you're marketing. You go in the supermarket, you're marketing. The community, you are marketing. You go to wherever you go, you are marketing. And don't drop certain things like people talking about business card don't work anymore. It works. You go to a function, you have your business card, you give it to somebody. You may give the business card to a chief nursing officer. You may give that business card to a CEO. You may give that business card to somebody else, and later on you can follow up with that person. Dear Mr. So-and-so, oh, it was so nice to meet you at this function, and I just want to touch bases with you to see, remember we were talking about the staffing agency. That works. I can't tell you how many of those people I have met and build relationships and have built business relationships in the community in the last 6.5 years since I have been doing this. It works, guys. You have to make it work. You have to build relationships. Your business card, your flyers. Make sure that your business is, you're branding your business in such a way that you stand out in the marketplace. When you have your business and marketing your business, try not to get so entangled into controversial subjects like political subjects and so on unnecessary. Of course, you can share your opinion, your views about about politics if you want. Of course, we all have an opinion, but at the same time, don't get into telling off people, calling them names and calling the president names and the president-elect names and so on. People look back and say, hey, I'm not gonna go into that. I'm not gonna go there. You have to keep it professional, because remember that even if you post a motivational post on social media, you are marketing, because no organization is going to sign a contract with you and don't look on your social media page. I'm telling you, they are not going to sign a contract or agreement with you. These big giant organizations that you're trying to get into, memorial system, the big hospital system, they're not going to sign your contract or sign an agreement with you. They're going to dig up your page. They're going to see let me see what she's posting. Let me see who she is. So you're always marketing and your brand stands out. You see people talking about branding. Branding is not your logo. Branding is not your color. Branding is you. Branding is who you are on a daily basis. You know what branding is? You're not just branding because you're in business. If you're a nurse manager sitting on this line today, if you are a CEO, if you are a staff nurse, you are branding yourself every day. Branding is who you are on a daily basis. It's your reputation. Branding is what they say about you when you're not in the room. Let that soak in. Branding yourself as a nurse is what they talk about you when you're not in the room. That's branding. And that's your reputation. It's the same thing with your business. If you're going to start a business, make it professional. Act professional. Post professional. Show up, because all of that is marketing. Everything works. So you're going to daily market. Your website must be clean. You must have a website to display your services. It must be clean. Social media page, be involved in the community. Those are the marketing services that you want to align yourself with. Then they have what you call a VMS, vendor management system. Vendor management system is like a system that acts as like a middleman between hospitals, large giant hospitals, and you. And what they do is that in order for you to get a contract from a particular hospital, you have to go through the vendor management system. And we can talk about that some more, but I personally don't use them that much because you have to your income decreases when you align yourself with the vendor management system, and that's something that I can talk about later on at another time. Word of mouth is so, do not underestimate the power of word of mouth. Word of mouth is never overrated. Okay, the next step is build relationships to receive clients. I have here relationships is equivalent to clients. Relationships equal clients. Excuse me, let me drink some water here. My vitamin water. Hospitals, long-term care, schools, correctional department. You can receive contracts and clients from these. Align yourself with these companies, with your staffing agency. So how do you stand out in the marketplace? We talk about branding yourself. We talk about how do you want to show up? How do you want to how can you be the top of mind for organization? Branding yourself. Be the best. Hire the best nurses. Send the best nurse in the organization. If you send a nurse in an organization and there's a complaint, follow up that complaint and get back to the organization and let them know that you followed up with the nurses. You re-educate the nurse. Follow up. If you get a complaint that the nurse did not know how to administer a certain drip, you have to teach the nurse, find a way to show the nurse and then you follow up with the organization. I believe in follow up. I believe if I get a complaint from a nurse, I'm not gonna within 24 hours, I'm gonna follow up and get back to that organization. Let them know you care. Treat it as if you are in your organization. If you're a leader in your in a hospital, if you're a nurse manager, a nurse leader, you're gonna do it just the same. There's no difference. Treat your nurses as if you're leading them from an organizational standpoint. Communicate with them via email or via text message or via call them how they're doing. If they call in sick one day, the next day call and ask them how are they doing. Whatever it takes, build a relationship so you can be on top of mind for not just your nurses but your clients. All right, so how are you going to be unique and be successful? You must carve out a niche for yourself. So a lot of people start a staffing agency and they staff everyone. Yes, you can staff everyone, but not initially. Wait until you really branch out into a large organization or your company grows. But if you're going to start now, like you're going to start today, start thinking of a niche. Just carve out a niche for yourself. What I mean is that if you're an ICU nurse, you may want to think that you want to staff ICU nurses or ED nurses. I started up in our company because let me tell you, I am an ICU nurse to the bone. I love critical care. I've been critical care nurse for many years. I mean, critical care and ED. I was a critical care bedside nurse. I became manager for critical care, became a director for critical care. I oversee critical care from a director standpoint and from a senior administrative standpoint, critical care and ED. So I love that two specialty. I know the specialty and I understand the specialty so well, and I never lose my critical care on my ED experience. Even when I was in hospital as a senior leader, I was able to go into ED and start IVs just like the staff, and that was it. I really kept up my skills. Even though, I was not doing patient care or anything, but I kept reading and I knew what was going on, because in that way I can support my nurses, I can follow up, I can know when they're stressed, I can know when they're short staffed. I know what I'm talking about. So don't lose your skills. So because of that, when I started my agency, I started my niche to be ICU and ED. Works well. I was training nurses. I was sending out emails to them. I was communicating with them. I know the language. I know how to follow up because that's my specialty. Then we add telemetry and med surg and step down and dialysis and those things. So if you're going to start a staffing agency, brand spanking new, carve out a niche for yourself. I have a client who started with just CNAs. You can start with CNAs only and you still make money. You can start with dialysis nurses only. So if you start with, say, dialysis nurses is your niche, you brand yourself as a dialysis staffing agency. everywhere on LinkedIn. You are the dialysis staffing agency. They say less is more, and it's true. So don't believe that you are missing out on anything when you don't carve out a niche. I cannot overemphasize that enough for a new staffing agency owner. Carve out a niche for yourself, because they say that when the vision is clear, the results will appear. I'm going to say this again. When the vision is clear, the results will appear. You're not missing out anything if you're not staffing. If a nurse calls you and asks you, oh, I'm a med-surg nurse and I want to work with your business. Of course, you can have her send your resume, but at this point, we're not hiring med-surg nurses. You can send us your resume in the event we start hiring med-surg nurses. So you start slowly and then you branch out, and then you start doing respiratory therapists. Then you start doing nursing assistants and so on and so forth. Find your niche in this healthcare staffing maze. That's the key to success. The key to success. And I have 7 steps, but this is the 6th one, and I have one more: pricing. Pricing is important. Pricing and I should say pricing and financing. Pricing and financing. Let's talk about financing. How are you going to finance your business? How are you going to finance this business? You can self-finance, meaning that you can use your own money to finance your business, or you can get a loan, or you can get a loan, or you can get a line of credit or something like that. But to start a staffing agency doesn't take a lot of money. Literally, you just need a startup cost. Your startup cost is your insurance, your taxes, your overhead if you have an overhead. It's really very low cost business. Especially if you have a client like a hospital who's going to pay you right away, you can literally start this business with under $1,000. And I'm very serious about it, but you have to know that you have a client that's going to pay you so you can pay your staff. Because no nursing staff or no staff agency nurse is going to wait 4 weeks for their pay. They want to be paid every week or every other week. In our staffing agency, we pay twice a week, but starting January, we're going to go once a week, because we realize that our team, our nurses, they can wait. I mean, not that they requested, but they say, oh, we don't mind. A lot of them said they don't mind paying. But if you have, check out your staff, get feedback from them. If your nurses don't mind waiting, it's good to have every one particular day. In the organizations, it's every other week, every 2 weeks, but don't wait for every 2 weeks in your company. Pay every other day. I'm sorry, no. But if you want, you can pay every other day. It all depends on your team. My team, most of my team members actually have their own jobs. So they work in a PRN basis, supplemental, 2 days a week, 3 days, 1 day here. They don't mind waiting, and it's easier for us to pay one. So we have been paying 2 days, twice per week, but we are starting January, we may go once a week. And if we see that nurses are complaining, we are going to probably switch back. It's very easy to switch back, because you want to meet the needs of your team. You don't want to have disgruntled nurses who, when you call them to work, they tell you no because you don't pay. And that's where your funding and your staffing comes in. Because if your organization is going to pay you right away, you can start it with very little money. But if you have a nursing home or a hospital or wherever who's going to pay you every 4 weeks, you have to use your savings to pay your nurses, your CNAs, your respiratory therapists. You have to use your funding, or you can get a payroll company or a funding company to pay or to fund it for you. There are a lot of different ways. If you don't have money in your savings to pay nurses or to pay your team, you can get funding, you can get a loan, you can get a payroll company to help you with that. But whatever it is, you have to pay your team. That's the biggest satisfier, when you pay them on time. So as far as pricing is that, once you get your contract, you get your client, you're going to figure out your bill rate. And your bill rate is what are you going to charge, or how much you're going to charge your clients. How much am I going to charge my clients? And you're going to charge based on what's going on in the market today, based on what's going on in the industry, based on you know, how busy things are. Right now, we are in COVID era. So most agencies their bill rate is a little higher. And some hospitals may say, no, I'm not going to pay any more. I want to pay the same. But if you're sending your contract to a hospital or to a nursing home or to someplace, you want to step it up a little higher, because we are in the COVID era and most hospitals will sign the contract or sign the agreement for you based on even though your rates are a little higher. And then you're going to pay your staff accordingly. You know, there's no rule of thumb, or there's no law as to how much you pay, but you're going to pay them reasonable based on the market. And I always suggest, this is what I always suggest. I suggest something like a 60-40, anywhere between 25%. You keep 25% to 40%. I don't believe in 50-50. I saw some agency saying that they pay 50-50. If they make $100 from the agency, they give their staff 50 and they take another 50. You can, if you want. It all depends on your market. I believe in 60-40. I keep a 40, they keep 60, or 30-70, or even 25-75. And you can change that based on what's going on. If you have to call in a staff late, if you have to call them a staff has been, you know, have to call in someone to go in late, or there is a staffing issue and that person, you know, you need someone to go in tonight, you can pay a little extra to go in, like a bonus. And we do that in our company a lot. We're going to pay you a little extra tonight. Can you go in? A lot of staff will go in if you add some extra money. If you pay something like, if you pay say $60-70 an hour, and tonight you want your staff to go in for $80 an hour, you want a staff to go in, you can up it to $75 or $80. Depends on how much you're getting as your bill rate. So your bill rate, you should kind of watch your bill rate and see, how much do I want to pay my team? How much do I want to hold back? And then what you're going to learn about if you go into staffing agency or staffing business, you're going to learn about profit margin, which is the percentage of the profit your company produces from the total revenue. And that's something you're going to learn that as you go along, that you have to pay attention. You don't want to pay out all of the money or the entire bill rate. If you bill $100 an hour, you don't want to pay the entire $100 an hour, because you have to factor in your overhead cost. If you have an office, a building, you have to factor in insurance and marketing and all these things that you have to pay for. You have to think about that as well, because you have to market. You definitely have to market. All right, so let's do the math here, and I'm almost done. If you want to learn, like, say for example, let's do the math for an RN model. I want to show you why this is such a great business model to step into today. Say your organization is paying you $90 an hour, and that's not unusual. You can get that. And you decide you're going to pay your nurses. This is just an example. You're going to pay your nurses $70 an hour. You hold $20. And yes, you can pay them $65. It's still reasonable. $60 is still reasonable. And you pay them as high as $70 an hour. You hold on to $20. All right, $20. If you want, you can hold on to $15, or you can hold on to $25 an hour. So if you staff one nurse every shift you staff a nurse, you're going to make $40 an hour for the day. Am I making sense here? Are you here? Are you with me? If you're with me, just send me a message. Yes, I'm with you. Send me a message. Yes, I am with you. All right? Okay. So you can make $40 an hour for the entire day, meaning $20 an hour in the morning, $20 in the evening. So you make $40 an hour for that one day. If every day you staff, so that is $960 you make for that day. If every day, Monday to Monday, you staff a nurse in the morning, 7A, 7P, and a nurse in the evening, 7P, 7A, that's 7 times 960, you make $6,720 for the week. If you still continue to staff that same 2 nurses a day for the month, you're going to make $26,880 for the month. If you staff 1 nurse every day and every shift for the month, it's $26,000. But what if you staff 2 nurses in the mornings and 2 nurses in the night shift? That's not unusual. That's normal, guys. especially if you have more than one contract. You can do that if you just have one hospital, but what if say you have 2-3 hospitals? You can staff a lot more nurses. But let's go as low as 2 nurses per shift. 2 nurses per shift will give you $53,000 per month. And if you want to decide, and then if you multiply that by 12 to see how much you make per year, you can make $645,000 for the year just by staffing 2 nurses every morning and every night. And this is just a rough estimate because you can staff 3 nurses, 4 nurses. If you just staff CNAs, it's a lot less. But I just use this example to show you, if you are consistent with your staffing, if you have 2 solid contracts and you have nurses, you have nurse practitioners, you have LPNs, you have CNAs, and you staff, you can make money. Look how quickly you can make $500,000 just by staffing 1 registered nurse in the morning and 1 registered nurse in the night. If you have 1 organization and that organization is busy, don't have a lot of staff, it can happen. If you have 2 organizations, it can happen. The thing about it is this. The reason why a lot of people don't make money from this thing is that they don't follow up. They have 1 client and they think that's good. Have 2 clients, have 3 clients, have 4 clients, and branch out and hire nurses. Take good care of your nurses so they stay with you and they work with you. So you can make $500,000 just by, or over $500,000 just by staffing 2 nurses 7A 7P and 2 nurses 7P to 7A. This is the direction, and this is how you calculate the math for the RN model. Okay, this is how you calculate the math. So I have on this, how much money do you need to start? Depends. Yes, your startup fee, your insurance, your business, your license, your overhead. If you seek to have an excellent paying client, and then if you have great paying clients, you won't have a problem because, you know, I've been blessed in our company. We have been so blessed because our clients seriously pay. We don't have any nursing homes yet. My understanding from some of my clients is that nursing homes take a lot longer to pay. And I'm not knocking any nursing home if you're on the line and you work with nursing home, but that's what they say. I don't have any proof. But most of these hospitals today, they pay you every week. The hospital will pay you every week because they're kind of like, they're at a higher level, a very high level, so they like to pay. So it works out good for our organization. So if you are going to seek clients that will pay. See clients that have a great reputation. Don't see clients that have a lot of tags and everyday joint commission is in their organization giving them citation. You can refuse clients if you want, but just be careful, be professional, be organized, and be consistent. How do you payroll? This is my last point. Payroll and funding, you can outsource your payroll with companies like ADP and Paycheck. We have funding sources available. We have a lot of that we can share with you later on if you decide, because we have a coaching and consulting program that I'm going to tell you about later on, and we can go deeper in that in the program. So they work with small business to manage their payroll and their taxes, you know. So bottom line is, it is so possible that you can start with very little, with like a shoestring budget, they call it. It depends on your organization that you're going to be working with. What are some of the biggest mistakes that nurses make, or that new business owners make? A lot of times they make mistakes. Biggest mistakes they make with staffing agency: inadequate qualified staff. They don't have a specific niche. They undermine the nurse's specialty. They send ER nurses to ICU and ICU nurses to the ER. They send med-surg nurses to the ER just because they want to get the ICU pay. But don't do that, because it will come back to haunt you, because the hospital is not going to be happy with you when you do that. Staff compliance, poor system in place. You need to have a structure and a system. Business is easy to manage when you have a structure in place. You have to have you can lack structure no matter what, but you have to have it in place. Inadequate follow-up, very high overhead cost. frequent cancellation. Don't cancel too much every single day. You're canceling your nurses. Have that in your in your policy or in your contract, in your agreement, that if the hospital cancel you at a certain time, they pay 2 hours or 3 hours. Some business owners don't succeed because of poor mentorship. So some of these are some of the biggest mistakes that prevent success. So here's a warning that I have for you. Invest in a coach, invest in a mentor. Because remember, invest in a coach, invest in a mentor. Because remember, you cannot see yourself in the picture when you're in the frame. You won't know what you don't know. You won't know what you can't do if you don't have a coach. I screwed up when I first started my business. I just thought that I knew what I was doing because I was a leader. I was leading people. I thought I could jump in and start a business. I failed miserable the first year. It was not until I solicit a coach and start learning from people like John C. Maxwell and Marsha and Evans and those kind of Andy, I forget Andy's last name, and all these people that I've invested in. I started growing because I really believe in investment. So if you are going to take on a business and you don't have a business coach or mentor, start seeking one, because you will succeed faster and it will prevent you from making costly mistakes. I have made a lot of costly mistakes. That's for another webinar. Get yourself a coach, get yourself a mentor. What's the key to success in a staffing business? Clients, excellent staff, relationship with your clients and your staff. Have a payroll system, and you have to market 24/7. You can do it. So Javier, we have been given the power. God has given us the power to generate wealth. You have infinite potential in you. You just unleash it. You can do it. So tap into your inner entrepreneurial expertise and start it. Start today. Pursue that inner passion that you have. Unleash your creativity. Impact lives and generate that income that you want to generate for such a long time. Build influences. Be the person you are meant to be and transform lives. Transform lives. And the question that I have here, how can we assist you in starting up your staffing agency? Are you on the line today and want to start a staffing agency? We can help you. How can we help you? We can help you to start it. So I want to share with you how we can help you. If you want to start a staffing agency and you need our help, you're going to send us an email to millions@myhealthcarestaffing.com. Millions, MILLIONS, at myhealthcarestaffing.com. Or you can go to our website. We have some information on it or the program that we have. But before I go and show you the program, let me just quickly take a look at these questions that you have on the box. I don't see any question. One question is, what were some tactics that were used to find out more about the potential market? And how did you figure out what qualifications were needed to start this type of a business? Would this business be similar to a healthcare consulting firm? No, it's not similar to a healthcare consulting firm. You're not consulting anything. You are literally getting nurses to place a staff. It is not a consulting firm. It's more of a service business. So the tactics is you're going to learn the business and you're going to hire nurses and you're going to send them to organization. The organization is going to pay you. From that, you're going to pay your nurses, your CNAs, or your LPNs, or your allied workers. So that's one question there. Let me look at another. I hope I answered that question. Let me look at another one. So here's the thing. I want to quickly go through this to make sure I answer that question. Any other question? Oh, here's a chat box. Yes, I can hear. Did you ever have to work a shift in order to keep your contract? Yeah, many nurses do that. I personally didn't have to do that because we have plenty of nurses. We have plenty of nurses in our organization. I don't work a shift, but I've known a lot of new staffing agencies just work a shift. Some of them, they are the nurses in their shift, not because they don't have nurses, but they want to be the nurse so that they can make more money. You can create your own staffing agency and you are the nurse in their staffing agency. You can partner with someone and you can do that. But in our organization, the truth about it is, because I've been in nurse leadership for so many years, I am connected to a lot of nurses in the community. So in 2 weeks, to be honest with you, when we really wanted to help our companies and all these our clients, in 2 weeks we hired 74 nurses in 2 weeks. In 2 weeks, 74, and these are not just nurses who are not qualified. These are real nurses. They have, but the word gets around, and the word of mouth, and they're from different organizations, and they're great. They already have their BLS, they have ACLS, they have their PALS, they have ventilator management, they can take up open heart, they can take your vents, they are hemodynamically savvy, EKG savvy, everything savvy. They are great nurses, great ER nurses. They know their triage, they know everything about their about their craft. So we didn't have to train them. The only thing we did, we just kind of go over with them, review the Joint Commission National Patient Safety Goal, so that we can let the organization know that our nurses are a little bit smarter than the other nurses. We also went over communications in healthcare. We went over customer service, patient satisfaction. Listen, when you tell an organization that your nurses are trained in patient satisfaction, TJC, which is the Joint Commission National Patient Safety Goal, CMS measures, and all these basic stuff that keeps CNO and CFOs awake at night, they love you. Especially if you send that. I attach that to all my contracts, all my agreements, that my nurses are savvy with the Joint Commission standard. They're savvy because, for one, not only do I review that, or it's in a booklet that they review, but guess what? They are also coming from organizations that are on the cutting edge. So make yourself stand out by giving your staff more, teach more, give more. Okay, let's see. I don't have a business. Good. All right. Let me see if there's another question. Any other question? I don't see too many questions. I think I've answered the questions already. So here's how we can help you guys. And before you get off the line, I wanted to share with you how we can help you to start your staffing business. We have a program that starts January the 7th. Our program starts January the 7th, and we have it's a 5 weeks training how to start your staffing agency. The cost of this is $525. Half of the regular cost. Regular is $979, but because you're on the webinar tonight, if you pay $527, and this actually ends tomorrow morning at 7 a.m. The reason is because my first webinar was last week Thursday, and I promised that it was going to end 24 hours. But then I got some calls and asked if we can extend it. So I've extended it to get more people to join and to start it, because I know a lot of nurses, a lot of people out there want to launch their company, launch your staffing agency. So the webinar rate for the 5-week program is $525. If you want to be a VIP, where you start your own, where you get a one-on-one from me or one of my consultants, is $1979. So I want to encourage you tonight, if you're on the line and you really believe that this is the way to go, this is the model that I want to go in my business. I have had many businesses and they all fail, but this one is not going to fail, and you want to put your all in this. Or if you have an existing business and you want to add a branch or add another arm to it, this is a great business model to go. Start your staffing agency. Go to our website. It will give you a lot more information. It's myhealthcarestaffing.com. www.myhealthcarestaffing.com. So 2 places you're going to check out tonight to get more information. If you still have questions, send me an email. $1 million, because you can make millions from this, at myhealthcarestaffing.com. Or you can go to our website. It's www.myhealthcarestaffing.com. Get on there, pay that $575. We lock you in for January the 7th. It's a group coaching. We don't want to keep it that huge, because if it's too big, we're going to split the class, because you want to get one-to-one attention within the group. If you cannot attend the group forum, you will get the recording. If you don't want to be in a group, you can be a VIP where you meet with us anytime, like still five courses, 5 sessions, but you pay $19.97 because you want to one-on-one. So get on the website www.myhealthcarestaffing.com. Scroll all the way to the bottom and you see webinar rate $527. We get you ready to start. You'll never regret this. But if seriously now, guys, if you're on the line, hear me out now. And if you're thinking that, listen, I am not ready to work hard. I don't know if this is gonna work. Do not pay. Because one of the things that I hate to see is failure. With anything that I put my hand to, it shall prosper. So I don't want anyone to come into that group and don't follow the blueprint, don't follow the system and fail. Then it reflects on us. So I want you to really, really start putting on your business cap, your entrepreneurial hat, and say, this is going to work no matter what. I'm going to follow the blueprint. One of the things that we're going to be doing in the blueprint is you're going to go on Medicare.gov and you're going to list, we're going to list all the organizations in your community. And guess what? We're going to teach you how to call them every day. We're going to teach you how to email them, how to get contract. So in this training here are the things that you're going to learn. In this group training, you're going to learn how to plan and how to prepare for a staffing launch, how to learn, lead, and launch. You're going to get a 15-page workbook for your, just a work guide for your reference so you can look back at. We're going to teach you how to get your business up and running in a legal manner. We're going to teach you how to market and operationalize your business. We're going to teach you how to recruit and how to retain staff. We're going to teach you how to secure contracts and increase clients, payroll resources, funding, all the pertinent forms. You're going to get sample forms like direct deposit forms, background check application form, the clinical checklist, the ED checklist, the nurse's aid checklist, the telemetry nurse checklist. All those checklists we are going to give to you. Templates of policy and procedure, templates of our employee handbook, and all of that you're going to get before you all of that you're going to get in the 5-week program. It is a great program, and this is like giving this program away for peanut. There's no way you can spend $525 and tell me you cannot make that back 2 months after you launch, unless you decide you're not going to make it work. Because there's no failure, no failure in my group. In our company, we don't believe in failure. We believe in pushing hard until you succeed. That's what focusing is all about. You're going to follow the blueprint. You're going to follow. And if you're not the kind of person who is going to really unleash that good thing, that goodness on the inside of you, don't sign up. You don't want to waste your money. But you got to work it, because no client is going to come to you without you reach out to them on LinkedIn, without you reach out to them, without you call them. We're going to teach you the script. We're going to show you how to send your email, how to call, how to write. You can do it. Get on that line tonight, www.myhealthcarestaffing.com, because I'm closing that cart off 6 o'clock tomorrow morning. Then we are still going to take individuals in for the regular rate. I just wanted to extend it to give some people a little bit more opportunity. You know, it's Christmas coming and everything, but you know, we want to open it up for a few more. So if you sign up tonight, we will give you some tips on how to start, like right now, getting your business legal and all these things. We'll check out your state to make sure their state don't need any specific license. If you are in the state of Florida, you need a license, and we can get your license for you. Whichever state you're in and need a license. A few states will need license. As I said before, I have them listed there, like Florida and Illinois and those places. If you're on the line and you're from one of those states that need a specific license, we can help you. If you're in Florida, we can assist you. You can send an email and we can let you know how much it costs for us to do it. But it's not rocket science. It's just take time. You can do it yourself. We can send you the website to save money. You can do it yourself. If you don't have time, we can apply for it for you. If you have time, go on the website, an ACA website, and search for healthcare staffing pool. Let me tell you, there are so many hospitals today in Florida that are begging for staff. Tonight, One organization asked us for 6 nurses. 6 nurses. Thank God we had them. 6 nurses. You know, and we're getting more contracts because there are people out there who are seeking contract. And there are many ways. Nursing homes, the rehabs, the correctional department, they're looking for nurses, LPNs, CNAs. You can become a staffing agency for nurses aides only. If you don't want to deal with RNs, nurses aid only. We teach you the requirements that they need to have, how to maintain their file so that you don't get into trouble with ACA, you don't get into trouble with any of the regulatory agency. We teach you how to be legal. There's a question here. Can I add to my home health agency, or would I have to start a new company? Well, you can do, if your home health agency, for example, is called South Florida Nurses Home Health Agency, you can do your staffing agency as doing business as, but you still have to register it. But you don't have to register it. You just register it under the same name. You're still South Florida Home Care, but you're doing business as South Florida Healthcare Staffing Agency. And again, it's good for you to check out, just double check with your attorney or your legal professional or someone from your state. But this is basically, you know, we don't give too much of a legal advice when it comes to this. But what we can tell you is that you can do business as, you don't have to register it separately. And most companies are registered as LLC. Most people register as LLC, and that's really to protect yourself and your personal assets. Most business owners register as LLC. You can do incorporation, or you can do like a sole proprietorship. But whatever way you go, work with a lawyer or your legal team, and then get it structured correctly, because you don't want to get into trouble in it and later on. Same thing when it comes to the taxes, whether you're going to hire them as employees versus independent contractor. You want to talk to your tax professional as well, because you can start up as independent contractor, but as time goes by, you can branch them off into becoming employees. Any other question? Any other question? All right, here's another. Let me get into the chat. Okay, let's see. Chat. Okay, no other question here. In this program, we will teach you everything you need to know, and you have to follow the script that we teach you to be successful. It's not anything that we're not going to leave you hanging out. This is going to be the last webinar for this until the next after January, and this class ends February 14th. We're not going to have another one until the middle of the year. But this is a hot time for you to get the agency up and running, guys. Don't wait till it gets slow. The Christmas is coming. Hospitals are craving for people. Already in our organization, we have gotten the request for Christmas already, because of course, you know, a lot of nurses want to take off on Christmas. The hospitals are short, they need people. You may not launch in time for Christmas, but you want to launch in time for this. You want to launch in time, especially, you know, for, you know, the COVID-19 is real and it's here. So you don't want to you want to tap into this $30 billion industry that is out there. All right, so I'm still checking the chat to see if you have any question. Can we have, yes, there's another question. Somebody said, did you ever have to work? No. Can you give your email again? Okay, the email is millions@myhealthcarestaffing.com. millions at myhealthcarestaffing.com. millions, millions, it's on here. Millions at myhealthcarestaffing.com. It's on the list here. Millions at myhealthcarestaffing.com. Then you can go to myhealthcarestaffing.com is the website, which is www.myhealthcarestaffing.com. That's where you go to pay the $525. We are closing that $525 deal off, no exceptions. Tomorrow is the last at 6 a.m. It's been closed. It's gonna close because we have dragged it out for like almost 4 days longer just because of other requests. But we have to honor what we're saying, because we don't want to keep telling our clients that that's the last day we doing it. We have to honor it, because that's also part of business ownership too. We have to hold some amount of integrity with what we say and what we say we're going to be doing. So 6 a.m. tomorrow, you have, if you pay after 6 a.m., you're going to go back to the $997. Okay, can you give your email again? I gave that, which is millions@myhealthcarestaffing.com. Thank you, Loretta. Thank you, Eva. This was quite informative. Thank you so much, Loretta. God bless. And can we have extension until Friday? I cannot have it until Friday. And here is why I can't have it until Friday, because then we lose integrity, because our clients, you know, we had people paying out of nothing because we told them it was Thursday was the last, or Wednesday, Friday was the last. But if you want to make a deposit, we can wait till we can give a Friday, but you have to make a deposit at least 50% of it before, and then we can hold it for Friday for you. But outside of that, we have to close the cart at 6 a.m. on Thursday morning. We want to honor our words, and we want to make sure that we're walking and living in integrity. Okay, guys, it was fun. It was nice. Thank you so much, and I hope to see a few of you in class. Start your staffing agency. We have other business modules, a model, then I should say, around. But listen, if you really want to take off, get on board and build your dream, build your empire, build that legacy. Some of you who have been thinking about building your own dream, your own passion, your own business for years, now is your time. Don't wait another minute. Some of us are waiting too long. All right? Have a good night, ladies and gentlemen. God bless. And remember, millions@myhealthcarestaffing.com, or go to www.myhealthcarestaffing.com. It will show you everything that we are going to be doing in the next for the 5 weeks training, and everything you need to launch your healthcare staffing agency will be discussed. You get your booklet, you get your forms, and we will teach you what it takes to succeed. God bless you. Have a great night.